Hey, so in the last video, I remembered that I ended by saying, see you in the next one, but I won't actually see you because this is a YouTube video and I have no idea who you are, when you might be watching this. But all that is to say, so we're going to start off with our STIs by going over herpes. But first, before we dive right into herpes, I want to just talk about just STIs a little bit more in general. Um, so, biggest thing is prevention. We want to prevent all of these STIs, right? So, the prevention that we use for most of them is very similar. Now, there's some specifics for each one, but just generally, the best, most effective way to prevent spread of STIs is through the use of latex condoms, right? That's true for all these STIs. Latex condoms, number one, we want that. We want people to use latex condoms. The other thing, if someone has an STI, we want to encourage them as much as we can to avoid intercourse with other people until their treatment is over. Now, I told you in the last video that we don't assume that our patients are going to abstain from sex, and that is true. So we don't assume that they're not going to have sex, but we want to heavily encourage them not to have sex with other people if they are infected, or if you're talking to a spouse or partner or something, we want to heavily encourage them not to have sex with their partner until they are treated. Having said that, because of the fact that we encourage them not to as heavily as we can, but we do not assume it. If someone is in a monogamous relationship, because obviously if they're in a uh, non-monogamous, if they're having sex with multiple individuals, it might not be possible to identify all the partners they're engaged in and stuff. But if they're in a monogamous relationship and they come in with an STI, oftentimes it is the case. This is the best practice that we treat both patients, or both partners, I should say. That whoever's presenting with the infection, we treat them, but we give the partner the same treatment. And the reason for that is because this thing can happen where, so first off, we tell them not to have sex, but they do it anyway because they want to have sex. And that's not a judgment. We're not judging them. I mean, it would be easier for us if they didn't, but it's we're not judging them. We're not anything like that. We're just it's the reality, right? We deal with reality as it presents itself to us. So the first reason is that they might have sex with each other. And if they do, then it's possible that they could spread the infection to the other person. The other reason, though, is that they might do exactly what we tell them and not have sex, but they might already have it and not be symptomatic, right? You can have someone who presents with symptoms and someone else who's got an infection and they don't present with symptoms. Some of these diseases, again, depending on the sex of the person or the genitalia they have, they manifest differently. Some of these diseases can stay seemingly dormant for weeks to months, like you don't have any real obvious signs that you have an infection immediately, and so it can lead to people delaying treatment. So you can actually have a situation where one partner has it, another partner has it, but they don't realize it. You start treating the one partner, you don't treat the other one. It's okay. They start having sex after the one person's infection's gone, but then they swap it, they get it back from the partner that wasn't treated. You know what I mean? And then maybe that partner starts to have, oh, I've got the symptoms now, so I must have gotten it from you. Okay, they treat that partner. Then we finish treating them. Then the other person starts having the symptoms again, like, oh, I must have gotten it too. So we just treat them. We treat them both if we can. For those that have lifelong STIs, so ones that can't be treated or cured, well, I shouldn't say treated. They can be treated, but the ones that can't be cured or removed, they need to use protection when engaging in intercourse. We also want to make sure that they notify partners. So if you're diagnosed with an STI, there's ways in which we notify partners or we do partner identification because again, we want to prevent them from potentially spreading it to other people if they've gotten it and they're unaware of it, or potentially getting some of the worst, adverse effects of having these diseases if they don't get treated. And then there are a lot of special considerations and interventions that we have to utilize if a patient is pregnant or will be delivering a baby when they have an STI present. Um, there's been a lot of advances in how this is done, but when babies are born and y'all will go over this more again in maternal infant nursing, so I'm not going to spend a lot of time on it. But in that course, you'll spend a little time going over it. But like when babies are born, we give them a lot of things immediately. Like we give them vitamin K shots. We put eye drops in their eyes. The eye drops in their eyes, some of those eye drops are actually to prevent STIs. So specifically like gonorrhea and chlamydia and things, because when the baby is born, if the woman who's giving birth has a gonorrheal infection, for example, present, the gonorrhea can get in the baby's eyes and cause an infection and gonorrhea in the baby's eye. So you can get, yes, optimal ophthalmological gonorrhea, unfortunately, which, yeah, if you look at pictures of it, it looks about as painful as it probably is. So yeah, there's special things we have to do to make sure, to try to make sure that the baby, when they're born, they don't contract the STIs as they come through the vaginal canal. In some cases, they might even have to have a C-section so they avoid the vaginal canal, but it kind of depends. And again, spend more time on that in maternal infant and stuff. So again, not in any particular order, but the first ones we're going to be going over are the herpes viruses. So herpes is a virus. It's a couple of viruses actually, and I'm going to start at the bottom here. It's not actually an STI, but it is part of the herpes family of viruses. But varicella or zoster virus, this is the chickenpox or shingles virus. So probably most of y'all have gotten the chickenpox vaccine. If you haven't, you probably got chickenpox as a kid, and now you have some immunity to it, but yeah, patients can still get shingles and stuff. So this one is a virus that can cause you to have an infection for 1 to 2 weeks. It's got, kind of itchy vesicles. Once you have it, it goes away after a few weeks. It's not the same as herpes simplex 1 or 2, but it is a type of herpes virus. And it's not sexually transmitted. It's just through contact. It's spread through contact. So the actual STIs that we're going to be talking about are herpes simplex 1 and 2. So these are commonly referred to as oral and genital herpes, respectively. But it's not necessarily correct to think of them in those terms, because they can both be oral or genital or in other places as well. They could be other mucous membranes. So yeah, you could have herpes simplex 2 in the mouth. You could have herpes simplex 1 in the genitals or other places. But that's just usually what they're called because that's where they kind of manifest themselves. And especially with herpes simplex 1, call it oral herpes because the way it manifests itself is usually as a cold sore. It is estimated that potentially as many as 90% of the world have herpes simplex 1. It is hard to know exactly because a lot of people have it and are unaware of it. But basically, when people get cold sores, that's what that's herpes simplex 1, and it's not usually present, but it happens when they're under stress and stuff, and they come cold sores because somebody gets a cold. It kind of inhibits their immune system, and so then they get the sore. But again, it's extremely common. It's very transmissible, and again, it's impossible to know. We don't actually really know how many people have it, but it's potentially as many as 50 to 90% of the world. Like you look at estimates and it's like a crazy range because we really don't know. But basically, a lot of people have this. Herpes simplex 2, again, is it's called genital herpes, but it's not. Both of these can be transmitted through sexual contact. But this one tends to be more grouped vesicles. So you'll have like a grouping of vesicles, right, as opposed to just a single sore somewhere. So in either case, you're going to have painful red vesicles or blisters that occur usually a couple weeks after exposure. And then until the patient dies, basically, unfortunately, they're going to have herpes. It never goes away. But they're going to have periods of outbreak and remission, right? So outbreak means they have the sores present. Remission means there's no sores present. And so basically they're the same as if they didn't have it. Now, one thing that's important to know, because this is very commonly not known. There's a lot of like people that think this. They think that if you don't have sores present, you are not contagious. That is not true. If you have the virus, you are always contagious. Even if no herpes sores are present, you are still contagious if you have herpes. So I'm stressing that because it is a very common misunderstanding. A lot of lay people have in regards to herpes is thinking if there's no sores, you're not contagious. Yes, you are. Now, the amount of the virus you're shedding is much reduced compared to when you have an active outbreak, but you are still shedding the virus. So the actual treatment is that we give them antivirals. So things like acyclovir or Zovirax. That's the most common herpes medication, at least at the time of this recording. It's not a cure, but it helps reduce the viral load so that it manages flare-ups, so that the outbreaks don't happen as often. And then we also encourage patients to engage in other things that can help prevent flare-ups. So like things like stress reduction and just eating healthy and taking care of themselves. That also can help prevent outbreaks. But again, they can always happen. They're going to have it for the rest of their life, unfortunately. But it can be managed very well. And there's a lot of people that live with herpes and they don't really have any long-term consequences. Just maybe a couple times in their life they'll have an outbreak if they something happens or they stop taking their meds or something like that. So again, it's not fatal or anything. That's just a nuisance, and you don't want it. But if people have it, it's not the end of the world. Just needs to be managed. And again, they're contagious, even if they are not having the outbreak. Hey, can't stress that enough. So I'll see you in the next video. Again, actually, I just need to correct myself. I won't see you because it's a YouTube video, but you know what I mean.